So this is the fourth online quiz that we are conducting, and it's a Herculean task to conduct an online quiz. And it's two big institutes in Kerala, that is GMC Thiruvananthapuram as well as RCC, are cooperating for, and a common platform for the quiz masters. And they are I think the last 1.5 months, they are doing a hectic activity and maximum interaction also. And I think it's a very fruitful quiz. And first of all, congratulations to the qualified teams, that is GMC Thiruvananthapuram, GMC Thrissur, RCC, as well as Pushpagiri Institute of Medical Sciences and Dadividi Hospital, for entering into the final round. And congratulations to all, and the best wishes to the team as well as the quiz masters. So I am once again thankful to Dr. Laila Rani, HOD GMC Thiruvananthapuram, as well as Dr. Jayasri, the head of department of RCC Thiruvananthapuram, because accepting my invitation as conducting this online quiz. Thank you very much. Over to you, ma'am.
Madam, unmute. Okay.
Okay. Good afternoon, everybody. All the teams as well as the viewers. First of all, I thank Dr. Rajan and Dr. Ani for inviting our Trivandrum team to conduct this quiz. We have joined hands with the RCC and private medical colleges to conduct this quiz. Our quiz masters are the young ones, young professors like Dr. Apuka Matthew from Somerville Medical College, then from RCC, Dr. Priya Mary Jacob. She's associate professor here. Then Dr. Anila, associate professor. Then Dr. Renu, Dr. Rari, and from my own department, we have Dr. Bindya, Dr. Surupa, Dr. Pratap Mohan, Dr. Jamie, and Siyat. They are all the quiz masters to conduct this quiz. Hope this goes on well. And all the best for all the teams from various parts of Kerala who are joining the quiz. I think it will be an enjoyment also, as well as academic. Okay, I shall pass on to Dr. Jayashree, the head of the department of RCC, and my dear friend, to continue.
Thank you, Laila. Good afternoon, all. Let me take this opportunity to thank IAPM, especially Dr. Rajan and his team, for inviting us also to participate in the conducting the quiz program. Hope everything goes well. Congratulations to all finalists and best wishes. I take this opportunity to thank our engineering and computer division also for the technical support. If there are any difficulties in between, please bear with us. And once again, best wishes to all the teams and all the quiz masters. Thank you.
Hello, any madam? Yes. Okay, come. Team.
Presentation. Yes.
Good afternoon. Am I audible?
Yes, sir.
Okay. So I hope the screen is also visible. Can you see the presentation?
Yes, sir.
Okay. So good afternoon to all the teams and welcome to the final round of the IAPM PG quiz. We start this quiz with a examination of whether the eminent personalities of or those who are going to become the eminent personalities of pathology tomorrow, if they can identify the eminent personalities of pathology from yesterday. So in this round, there are 5 questions. There will be 1 question for each team. No question will be passed to the next team. For each question, it starts with a photograph. If you can identify the person from the image, you get 30 marks. If you cannot, you can ask for a clue. If you get the answer in the first clue, you get 20 marks. And if you do not get the answer still, you can ask for a second clue. If you use the second clue, you get 10 marks. For all this, that is for the picture and the 2 clues together, you get a total of only 30 seconds. All right. And in spite of all the eminent personalities that are there in this round, in the event of any dispute, the decision of the quiz master will be final. Okay. So shall we start? Team A, RCC, are you ready?
Yes, sir.
Okay. Time. We'll start the time now. This is the first picture. Answer. You can request a clue if you want one.
Clue number 1.
First clue.
Eyelids.
Time up.
Clue 2.
I'm sorry, time is up. The answer to this is all Langerhans. Now we move on to team B. Okay. The time can start now. Team B.
Clue, sir?
This is the first clue.
The second clue, sir?
Second clue, there are 2 pictures. This is the first picture and this is the second picture. First picture, second picture. Time up, I'm sorry. We move on to team C. The answer for this is, James Stephen Ewing, who saw was Ewing sarcoma. Start. Team C.
The first clue?
This is the first clue.
Second clue.
Second clue. Time up, I'm sorry. The answer to this is von Recklinghausen. Next team. Are you ready? Time can start. Team D.
First clue, sir.
This is the first clue.
Rosenthal. Rosenthal.
Next name.
Sorry, I can't hear you. Time up.
Maximum industry. Maximum.
Time is up. This was the second clue. The answer is Homer right.
Homer right.
Team E.
Yes, sir.
Yes, your time starts now.
Exclusive.
This is the first clue.
Second clue.
Second clue.
Golgi.
Camelogogy.
Golgi.
Correct. You get 10 marks.
Shall we move on to the next round? So next round, it's questions based on general pathology. About the rules, there are 10 questions. Each team will get 2 questions. Each question carries 10 points. And there is no pass in this round and no clues will be given. So this is a picture showing the effect of cyclin D kinase and cyclin D kinase inhibitors on cell cycle. 2 areas that it is hidden. You have to identify that. Time starts now. Team A.
Madam, face on, madam.
It's not the phase. You have to identify the cyclin and CDKs.
D, cyclin D. First one, cyclin D.
Cyclin D
D.
and the CDK.
4.
Okay, next one.
Next one. Cyclin B. D.
Okay.
Cyclin CDK 1.
Okay. Yeah, we gave the right answer. So 10 points for team A. The cyclin D CDK4 and cyclin B CDK1. Question number 2 for team B.
E6, P53, E7 retinoblastoma.
No, it's wrong. So you get 5 points. The first one is right. It is inhibition of P53. Second one is inhibition of P21. Retinoblastoma was already there in the picture. So you get 5 points. Team C. This is a picture showing the role of inflammasome on acute inflammation. You have to identify the components of that protein complex. Time starts now.
Team B അല്ലേ നേരത്തെ
ചോദിച്ചു
ഇല്ല
ഏതെല്ലാം റിപ്പീറ്റ് ആൻസർ ചെയ്ത
Pardon?
ടീം എ തന്നെ ആൻസർ പറഞ്ഞതാണ് പ്രീവിയസ്
അതെ
ഏതന്നെയാണോ രണ്ടും പറഞ്ഞത്?
ടീം ബിനോട് ചോദിച്ചിട്ടില്ലേ?
Okay, last.
Procaspase.
So this is team C, right? Okay, what are the components of the inflammasome?
Procaspase 1.
Okay. Time is up. So you get only half points. That is 5 points. The components are the node-like receptor P3, that is a sensor. Then you have the adapter and the caspase 1, which is the inactive form. So next question is for team D. This is the energy balance regulatory circuitry. You have to identify the hormones that is produced from the fat and the stomach. Time starts now.
leptin and ghrelin alle. Okay. Leptin and ghrelin.
You're right. You get 10 points. The answer is leptin is from the adipocytes and ghrelin from the stomach. Question number 5 for team E.
Sorry, ma'am. Can I interrupt now? This question was answered by team B, box.
Yes, ma'am. Yes, ma'am. Team B.
Yeah, team B had answered that question. Not team
We
A.
were specifically asking to the teams. Team D. I said team D.
Yes.
Hello, ma'am.
And we are not changing the order also.
Hello, madam. Narthe, what happened?
This question for team B? Ma'am.
Ma'am, in between, I think team A answered 2 questions together. This,
Okay, after that I asked team C. The next was for team D.
I think the
That
team
already answered.
that was answered by team B now, not team D.
Okay.
Just cancel this one. Cancel this.
Two extra questions are there. Namukku team D യും E യും കൂടി question ചോദിക്കാനുണ്ടായിരുന്നു. 2 questions are there.
Team. Okay, A, C, and A, B, and C have already answered.
A, B, and C.
So A
B
got
is-
2 chances.
Any C.
So A finishes this round.
D, now
So
this
next is for team.
D have an answer. B and E.
നമ്മൾ ഇങ്ങനെ ഒരു can I just cancel
Huntington. Huntington.
Five questions. Cancel on. Okay.
Actually, what happened was, how many questions are left now?
Only 6 on the.
Only 6 questions. You just asked 5
5
questions.
questions.
Start with it.
Team
Tell that
A,
the first 5 questions we are cancelling and we get only just 5 marks.
and to answer, like when you are saying team A, only they should answer. We
There's
cannot
no pass.
check.
Once
So,
you
because you were asking
Ask
for
for
team B,
specifically
you
choose
specifically asked for team B.
I can't unmute you.
Can you hear?
Am I audible?
Yes, ma'am.
So like we will cancel the 4 questions already asked. We'll start.
Madam, പക്ഷെ ഇവിടെ മാർക്ക് ഇപ്പൊ നമ്മള് reading that they are answering.
Madam, it is 6th total. Okay, we'll cancel the questions till now. We'll start with question number 6 for team A. Only team A should answer. Number, not this question, the next question, team A should answer. Okay, shall I start?
Okay, ma'am.
Screen sharing.
We are screen sharing, right?
Slideshow. Right. Okay. So for team A, identify the condition.
Patau syndrome.
Pardon?
Patau syndrome.
Okay, it's right. You get 10 points. You're seeing the cleft lip, cutis aplasia, clenched fist, Rocabottom feet with polydactyly and hollow prosencephaly. The answer is trisomy 13. Next question to team B. What is common in these lesions?
BRAF V600E mutation.
The correct answer. So team B gets 10 points. It is a malignant melanoma, adenocarcinoma colon, hairy cell leukemia, papillary carcinoma thyroid, and LCH. The common factor is BRAF mutation. Team C. Question number 8. Identify the two proteins.
Associated with chronic inflammation, SAA protein, and A beta associated with acquired mutation.
One answer is right. The first one is AL amyloid, and the second one is AA amyloid. So you get 5 points. And team D. Question number 9. Identify the chromosome structural defects. Time starts now.
Two is inversion.
Okay. What did you say?
Inversion.
Which one?
Yeah, 2.
2 is inversion. Okay, it's right. 1. Time is up. You get 5 points only. First one is isochromosome and the second is inversion. And the last question to team E. Identify the condition and name the stain used in the second picture. Time starts now. Time is up. So no points for team E. The answer is cerebral malaria and the special stain is field stain. So after 2 rounds, team A scores 10 points, team B 10 points, team C 5, team D 5, and team E 10 points. Thank you.
Yes, we'll begin the third round. Am I audible?
Yes, ma'am.
Yes. This is the clinical pathology round. The rules are same as for the previous round. There are 10 questions and each carry 10 points. There will be 2 questions for each team and questions will not be passed on. We'll start now. Only the team to which the questions are asked should answer, and this will be to the team A. Identify the test used in screening for detection of thalassemia. Time starts now. Good. This is a very sensitive screening test for beta thalassemia. 10 points to team. Question number 2. Which color bag should be used for disposal of mask and disposable linen gown according to the COVID-19 BMW guidelines? Time starts now.
Team B.
This is team B.
Team B and B.
Team B. This question is to team B.
Team B, unmute. No,
Time
unmute.
is up. Time is up. The answer is yellow bag. Next question is to team C. No points. In beam test, the source of antigen is obtained from which organ of an individual with sarcoidosis? Time starts now.
Team C.
Team C. This is to team C.
Lymph node.
Wrong. The answer is spleen. So no questions, no marks. Sorry. This is to team D. Identify the crystal in urine.
Ammonium biurate.
Time.
Ammonium biurate.
Correct, correct. 10 points. This ammonium biurate thorn apple. This is to team E. Question number 5. What does O in blood group O stand for?
No antigens.
Wrong. It is a German word, own, which means nothing, without. Next is question number 6, again to team A. The CBC analysis showed thrombocytopenia. Identify the cause. Time starts now.
Platelet aggregation, ma'am.
Reason? Yes, I think you get the 10 points. It is the EDTA-induced pseudothrombocytopenia. Next is question number 7 to team B. A 64-year-old male complains of low backache and elevated ESR. An investigation protein was seen in serum protein electrophoresis. Read this serum immunofixation and identify the proteins.
Team D, you're not audible.
Team D, this team D, C can.
You're not audible.
Team B.
Myeloma.
C.
Repeat.
Team B, what's your answer?
Multiple myeloma.
No, I identify the protein. Okay, no marks. It is IgG kappa monoclonal protein. Okay. Next question to team C. A 12-year-old girl presented with history of intermittent jaundice from early childhood. On examination, splenomegaly, peripheral smear showed microcytic hypochromic blood picture. From this chromatogram, arrive at a diagnosis. Your time starts now.
Beta thalassemia.
No. Okay, the answer is hemoglobin E beta thalassemia. Question number 9 to team D. A 22-year-old female presented with pancytopenia without organomegaly. Past history, there was a middle circulatory stroke and episodes of cola-colored urine. What is your probable diagnosis? Time.
Paroxysmal nocturnal hemoglobinuria. PNH.
Yes, correct. 10 points. And the last question in this round to team E. A 2-year-old male child presented with prolonged bleeding, peripheral blood smear, moderate thrombocytopenia, and giant platelets. Flow cytometry showed an abnormality in GP1B complex. This is the platelet aggregator. Sorry, answer? Correct. Get 10 points. So next. Yes. So at the end of the third round, the team A gets 30 points, team B 10 points, team C 5 points, team D 15 points, and team E 20 points.
Good afternoon to all participants. We'll move on to the next round. This is round 4, and the questions are based on hematology. There'll be 10 questions, each carrying 10 points. There will be a total of 2 questions for each team, but it'll be in a cycle, okay? It will not be 2 questions together. After one set of questions go to the entire team, then again we'll get back to team A. Questions will not be passed down. So we'll begin with case number 1. A 1-month-old infant presented with coarse facial features, clouding of cornea, hepatosplenomegaly, skeletal deformities. Interpret figure A and B and name the underlying disease. Time starts now. Team A. I didn't get any answer from team A till now. So the answer is it's Alder-Riley anomaly. You can see the coarse granules in neutrophils, and lymphocyte is also showing granule with a clear halo around it. And the underlying disease is mucopolysaccharidosis. In this case, Hurler syndrome. So 0 point. Case number 2 to team B. 28-year-old presented with gross painless hematuria. He had experienced occasional bouts of jaundice and several attacks of joint pain. Interpreting the clinical history and peripheral smear, what is your diagnosis? Time starts now.
Hemolytic uremic syndrome. Hemolytic uremic syndrome.
Sorry, that is the wrong answer. That is the wrong answer. Okay, so this is HBSC disease. You can see the history itself is that of sickle cell anemia with joint pains. And in the peripheral smear, you can see the sickle cell. You can see a lot of target cells. Also the irregular densely stained RBC, which contains the HBC aggregates. Okay, so both with the target cells and the sickle cell and the history, you can give a diagnosis of HBSC disease. The next question, case number 3 to team C. A 30 years young woman presented to OPD with fatigue, weakness of lower limbs, and heavy menstrual bleeding since 6 months. Interpret figure A and figure B. Give your diagnosis. And the time starts now. Okay, that is your interpretation of figure?
B.
Yeah, you're correct. Go ahead. Figure B, right?
B. Okay.
And
this is
figure
atrophic gastric.
Yeah, so the diagnosis?
Megaloblastic
diagnosis.
Pernicious anemia.
Okay, I'll give you 10 points for that. So this is chronic atrophic gastritis, this is megaloblastic anemia. Patient is also having neurological symptoms. So the final diagnosis, pernicious anemia. So team C gets full 10 points. So we go on to the next question. That is case number 4. That is to team number D, team D. Interpret the RBC indices. Peripheral smear picture is also given for your aid. And now give your diagnosis. The time starts now.
Agglutination. What agglutination is?
Louder, you're not audible.
Hello? Agglutination, madam. Agglutination.
Okay, yeah, I just heard agglutination. Can you interpret the indices? Can you just give? I can't hear.
Hello, madam.
MCV is elevated.
MCV is elevated.
RDW all elevated. RBC count is reduced.
Okay.
Autoimmune hemolytic anemia.
You have to be more specific.
Due to clumping of RBCs, MCV is elevated.
Specific, be specific. Clumping of RBC, so what is that?
Autoimmune hemolytic anemia.
No, I want more specific answer, but I'll give you credit for the interpretation. Okay, I'll give you 5 points for this. So here you can see that there is clumping of RBCs, as they said. So there is a spuriously, it is not just low, it is a spuriously low RBC and hematocrit. Since it is a denominator, there is a spuriously high MCH and MCHC, but hemoglobin is normal. MCV is also high because the doublets are read as a single RBC by the analyzer. So the more specific answer I expected of you is cold agglutinin disease because it's in room temperature, right? Okay, so that is 0 point. No, hello, sorry. I'm extremely sorry. It's 5 point. Fine. Okay, and case number 5, that is to team E. A 66-year-old male was admitted complaining of an unexplained weight loss. The laboratory workup showed deranged hepatic and renal function with proteinuria, normocytic and normochromic anemia, and thrombocytopenia. Give your diagnosis. Time starts now.
Amyloidosis.
Yeah, I'll give you credit for that. So in the bone marrow aspirate, you can see the purple amorphous material, the plasma cells, and the apple green birefringence. Can you be more specific? I'll give credit for amyloidosis, but more specific. Since there is plasma cytosis and the symptoms were systemic, amyloid light chain amyloidosis. Yeah. So they get 10 points. So back to team A. Team A, are you ready? Case number 6. Peripheral blood picture at birth of a 38-week gestation boy born to a 38-year-old mother is given. Physical examination findings include upslanting eyes, webbed toes, and a murmur consistent with ventricular septal defect. Name the mutation seen in this disease. Time starts now.
Translocation 122. Down syndrome mutation trisomy 20 AML.
Mutation, which is the mutation that is seen in this condition? Team A.
AML 7 mutation 122. Translocation 122.
No. So the answer I expect of you is GATA1 mutation. The reason is this child is having Down syndrome. And there is a leukocytosis, and you can see blast cells. You can come up with a diagnosis of transient abnormal myelopoiesis, and even if you say it is Down syndrome associated myeloid leukemia is also, I will accept it, but the mutation in both would be GATA1 mutation. So 0 point. Next is team B, case number 7. A 3-year-old boy presented to OPD with a history of bruising around his eyes for the last 2 weeks. Bone marrow picture is given. Give your diagnosis. Time starts now. Yeah. What is the diagnosis?
Retinoblastoma.
Retinoblastoma. Can you complete it? What is this? Retinoblastoma where?
Metastasis to bone marrow.
Yeah, metastasis to bone marrow. So here you can see foreign group of cells in rosettes with scanty cytoplasm, and the child is showing raccoon eyes. That is, there is bluish discoloration under the eye due to orbital metastasis due to blocking of palpebral vessels by tumor cells. So they get 10 points. Sorry. Yeah. What was the answer that they had given?
Retinoblastoma.
Okay. So you get 0 point for that. I thought you had said neuroblastoma. It is neuroblastoma. Okay, neuroblastoma metastasis. But I would, yeah, you have to come up with a diagnosis of neuroblastoma itself, because that is the one that shows metastasis to bone marrow and presence as raccoon eyes because of orbital metastasis. You're not seeing a neuroblastoma in this case. Okay, so the point is 0 point. Case number 8 to team C. 22-year-old woman came to OPD with history of prolonged mucocutaneous bleeds following trivial injuries. Interpret the peripheral blood picture and give your diagnosis. Yeah. Yeah. Can you repeat once more? May-Hegelin anomaly. Yeah, it's correct. It's correct. You can see the dolly body-like inclusion and the megathrombocyte. The answer is May-Hegelin anomaly. Case number 9, that is to team B. 34-year-old pregnant woman presented with pallor and mild splenomegaly. Lab investigation revealed low hemoglobin, hypochromic microcytic anemia, and reticulocytosis. In the given figure, identify the marked structure.
HBH inclusion.
Yeah. So they get 10 points. That's the correct answer. You've got the golf ball inclusions or the HBH inclusion. Finally, case number 10, that goes to team E. Peripheral smear of 60-year-old post-renal transplant patient. With the help of given figure, give your diagnosis.
Trypanosomes.
What is it? Can you please speak loudly? I couldn't hear you.
Trypanosomiasis.
No, that is not the right answer. This toxoplasma, there are crescent-shaped tachyzoids with pointed one end and blunt one end, and there is a centrally placed nucleus. So this is toxoplasma. So at the end of round 4, team A gets a total of 30 points. Team B gets a total of 10 points. Team C gets a total of 25 points. Team D, 30 points, and Team E, 30 points.
Thank you, Surupa. We are now over to round 5, which is on flow cytometry. So in this we have 5 questions, one for each team, and each question carries 10 marks, and you can't pass your question. Okay, so the first question goes to team A. Name the principle of flow cytometry illustrated in the figure. Time.
Impedance, VC, volume, conductance, scattering, impedance, ma'am, electrical impedance, line flow, linear flow.
So that's the wrong answer. You get 0 points, and the answer is hydrodynamic focusing. Okay, that's one of the principles of fluidics used in flow cytometry. So team B, what is the flow cytometry gating technique shown here? Time starts.
Gating technique. Fluorescent, fluorescent.
0 points. The gating technique shown here is back gating. Okay. Now, question 3 goes to team C. How is the typical intensity of CD45 fluorescence on lymphoblasts when compared to mature lymphocytes? Time.
Madam, they are CD45 dim positive.
Yes, excellent. So So team C gets 10 marks. That's the correct answer. Dim or weaker than mature lymphocytes. Now coming to the question 4 for team D. Flow cytometry in bone marrow sample of a 5-year-old. What is depicted here? Time starts.
Acute leukemia.
Wrong. So that's the wrong answer. They get 0 points. What is shown here is hematogones. Now, next is the 5th question for team E. Flow cytometry in the peripheral blood done in a 12-year-old. What is your diagnosis? These are the charts. Okay, time starts.
LCH.
Yes.
LCH.
LCH. No.
Acute
Wrong
leukemia.
answer. Yeah. It's 0 points. The answer is T lymphoblastic leukemia. As you can see, 4 and 8 are double negative. The T cell markers are positive. 1A is positive, which is a marker of immaturity. So it is T lymphoblastic leukemia. Okay. So at the end of the 5th round, the total scores are this. Team C from Pushpagiri is leading with 35 points, and team A, D, and E, that is RCC, GMC Thrissur, and GMC Trivandrum, are second in place with 30 points, and team B from Rajagiri is third with 10 points.
Next round is cytology. This round has 10 questions. Each question carries 10 marks and questions will not be passed. For cytology, for diagnosing, clinical history is important. So in needy areas, it is given. You have to go through that and then the photomicrograph and then arrive at the diagnosis. First question to team A, vitreous humor cytology, identify. First picture is the ophthalmoscopic finding and next is the photomicrography. Time starts now. This is to team A.
Blastomycosis.
No, it's the wrong answer. It's asteroid bodies. 0 marks. Then second question, that is to team B. 25-year-old female, right upper abdomen pain. USG shows a large mass in the right lobe of the liver. AFB 10 nanogram per ml. This is the photomicrograph. Time starts now.
Hepatic adenoma.
No, it's a wrong answer. Answer is fibrolamellar variant of hepatocellular carcinoma. You can see that cytoplasmic inclusions in that. Next question to team C. 45-year-old male, painless parotid lesion, 1.5 centimeter, FNAC smear. Time starts now.
Pleomorphic adenoma.
No, it's a wrong answer. It's a mucoepidermal carcinoma, low grade. Next question to team D. 29-year-old male with an intradural extramedullary lesion in the chorda equina, intraoperative splash smear. What is the diagnosis? Your time starts now.
Neuroblastoma.
No, it's a wrong answer. Answer is myxopapillary ependymoma, 0 marks. Next question to team E. A 52-year-old woman presented with dysphagia. An endoscopic ultrasound shows an esophageal mass measuring 1.5 centimeter in the middle third of the esophagus. Endoscopic ultrasound guided FNAC of the mass was performed. FNAC and along with the cell block image is there. This is the FNAC image and the cell block section. Your time starts now.
Granular cell tumor.
Is correct answer. Team E got 10 marks. Next question again to team A. 45-year-old female, fever and painless bilateral cervical lymphadenopathy. FNAC and the cell block taken from the lymph node. IHC done on the cell block. What is your diagnosis? This is the photomicrograph. Your time starts now.
Rosae Dorfman.
Correct answer, 10 marks. Next question to team B. 35-year-old female umbilical nodule FNAC. This is a photomicrograph. Your time starts now.
Endometriosis.
Yes, correct answer, 10 marks to team B. Next question to team C. 51-year-old female was incidentally found to have a large, well-defined right renal mass. FNAC done. What is your diagnosis? Photomicrograph. Your time starts now.
The plasmacytoma.
No, it's a wrong answer. Answer is renal oncocytoma. Next question to team D. 40-year-old female with a discharge PV, pap smear. What is your diagnosis? This is a photomicrograph. Your time starts now.
Parasitic. Schistosomia hematobium.
It's a wrong answer. It's an inflammatory smear with enterobius vermiculari infestation. That is a pinworm. You can see in the bile stained eggs. Okay, next question to team E. 40-year-old male, renal transplant 4 weeks back, urine sample. This is the photomicrograph. Your time starts now.
Decoy cells.
Okay, correct answer, 10 marks. At the end of the 6th round, team A got 40 points, team B 20, team C 35 points, team D 30, and GMC Trivandrum 50 points.
Moving on to round 7. That is gross specimens. Once again about the rules, each team will get 2 questions, but in 2 cycles. Okay, I hope you don't have any confusions in that. And the question will not be passed to the next team. So team A, the history given is female 55 years. Time starts now.
Endometriotic cyst, chocolate cyst.
No, it's a wrong answer. You can see the cystically enlarged ovary. Cut section is showing the classical appearance of colloid. So the answer is tumor ovary. Team B.
Yes, ma'am.
History given is male 30 years. Time starts now.
അല്ല ടെസ്റ്റിസ് അല്ലേ എംബ്രിയോണൽ കാർസിനോം
With this much areas of hemorrhage, what is the first DD you will consider?
Choriocarcinoma.
Okay, that's a right answer. You get 10 points. Next question is for team C. Female 58 years. Time starts now.
Stellate scar. Madam, this is stellate scar. Serous cystadenoma.
Can you be more specific?
Pancreatic serous cystadenoma.
Pancreas, it's a microcystic serous cystadenoma. Okay, you get 10 points. Team D. History given is male 60 years. Time starts now.
Angiolipoma.
No, it's a wrong answer. You can see the normal adrenal tissue towards the periphery. That is a golden yellow color. And you're seeing a unencapsulated neoplasm showing adipose tissue and areas of hemorrhage. That represents the marrow element. So the diagnosis is adrenal myelolipoma. 0 points for team D. And team E. History is female, 55 years. Time starts now.
Carcinosarcoma.
Pardon?
Carcinosarcoma.
Identify the organ. No, it's a wrong answer. You are seeing the muscular sac-like bladder filled with a neoplasm showing papillary front. So the diagnosis is carcinoma urinary bladder. Going back to team A. Male 35 years. Time starts now.
Okay, sarcoma, botryoids. Botryoids, rhabdomyosarcoma, botryoids.
No, it's a wrong answer. You're seeing the valve cusps. It is showing large irregular warty vegetations of infective endocarditis. Next question to team B.
Yes, ma'am.
Female 32 years.
Carcinoid tumor.
It's the right
Appendix.
answer. You get 10 points. Next question to team C. Male 15 years.
Giant cell tumor of bone.
No, it's a wrong answer. You are seeing the tumor in the medullary cavity of diaphyseal area. So the diagnosis is Ewing sarcoma. No points. Next to team D, female 50 years.
This ma'am.
Pardon?
Gastrointestinal stomach tumor.
It's the right answer. You get 10 points. And the last question of this round to Team E. History is male, 39 years.
Madam, team Mari.
How come team B
To the team which is supposed to get.
whoever answers that
ഇനി ഏത് ടീമിനാണ് കിട്ടാത്തത്? This is the last question. This is for Team E.
Team E.
Madam, E
നേരത്തെ ഈ ആണ് പറഞ്ഞത്.
ഇല്ല, why E answer?
പറഞ്ഞാ മതി.
നിന്റെ എവിടെ ഏത് കോട്ടേഴ്സ്? ഞാൻ വരുവാണെങ്കിൽ
അവർക്ക് കൊടുത്തിട്ട് ലാസ്റ്റ് ക്വസ്റ്റ്യൻ
ബി ആണ് ആൻസർ പറയാത്തതിന്. ഡോഗ് ബി.
മാഡം ഞങ്ങൾ പറയുന്നതിന് മുമ്പ് അവര് പറഞ്ഞു. വേറെ അടുത്ത ക്വസ്റ്റ്യൻ.
മാഡം
ഇനി ക്വസ്റ്റ്യൻ കിട്ടാത്തത് ടീം ഡി ആണോ? ഓക്കെ, ടീം ഡി. ഫുൾ സ്ക്രീൻ ഒന്ന് ആക്കണോ?
Full screen. F5 makes it full screen. Fine.
F5 ചേട്ടാ സോറി. അൺമ്യൂട്ട് ചെയ്താലോ?
ഇനി മൈനസ് മാർക്ക് കൊടുക്കണം.
So this question for Team D. History is male, 39 years. Time starts now.
Biliary tuberculosis.
It's a right answer. 10 points for Team D. So at the end of round 7, Team A gets 40 points, Team B 40, Team C 45, Team D 40, and Team E 60 points. Thank you.
Now we go to the next round. Can you hear me? Okay. There are 5 questions in this round. This is histopathology techniques. There are only 5 questions. So whoever it goes in the order A, B, C, D, and E. Whoever answers without which when it is not your turn will be getting negative marks. So each question carries 10 marks and the questions will not be passed. There are only 5 questions in this round. So first question goes to Team A. Identify. Team A.
Microplate.
Microarray plate. Okay, you get the point. It is tissue microarray block, 10 points. Next question goes to Team B. Identify.
Antibody. I see. Immunohistochemistry. Host radish. Antibody.
Okay, that is already written on it.
Secondary antibody in immunohistochemistry.
This is the secondary antibody kit of for IHC. So you get 10 points. Team C, what is this and where is it used?
It is a, madam, it's a buffer used for a special stain.
Okay, the answer is wrong. This is chemical oxidation or ripening agent used mainly for Mayer hematoxylin. Next, question 4 for team D. Identify the type of section seen and the stain used.
Trichrome stain.
Time.
Trichrome stain. Second question. Trichrome stain.
Okay, the answer is wrong. This is a
Trichrome
semi-thin
stain.
section. No, this is a semi-thin section for peripheral nerve biopsies. Stain used is toluidine blue. Next question goes to team E. This is the last question. Identify the instrument.
Weighing machine, ma'am.
The answer is wrong. This is a digital pH meter. Okay, thank you. So at the end of this round, team A gets 50 points, team B gets 50 points, team C gets 45 points, team D gets 40 points, team E gets 60 points. Thank you.
ഇത് ഇങ്ങനെയാണോ കാണുന്നത്? എനിക്ക് ഫുള്ളായിട്ട് പറയാൻ പറ്റില്ലേ? ഗ്രിഡ് ക്യാൻ ബി.
So this is the histomorphology round. Histopathology, the round 9. So the rules are, this round has 10 questions. Each question will be carrying 10 marks and the questions will not be passed. So each team wait patiently for their questions and don't be in a hurry because we'll have technical difficulty if you overshoot the other participants and try to answer. So stick on and be patient and wait for your turn. So question number 1 to team A, male 31 years, chronic diarrhea. Time starts now.
Giardiasis.
Yeah, you are correct, 10 marks. Question number 2, and let me tell that these are very direct questions, so be as specific as possible. So question number 2 to team B, 15-year-old girl with parotid mass. Time starts now. Be as specific as possible.
Adenoid cystic carcinoma?
No, you're wrong. These are actually secretions. And the previous slide was not at all looking like a adenoid cystic carcinoma. It was a different pattern. So this is secretory carcinoma with the ETV6 NTRK3 mutation. Question number 3 to team C. 35-year female, swelling front of neck. Your time starts now. This is another view. Be specific. It is a direct question, so be more specific.
Madam, it's papillary carcinoma, thyroid.
Be specific. Yeah.
Columnar cell variant.
Okay, I think out of the 10, I can give you 5 marks, but it is a very characteristic picture that the previous one showing the tram tracking arrangement. And this you can see the cells are quite tall. Okay, 2 to 3 times tall. So you will get 5 marks. To team D, it is to team D, no? D. Yes, 46-year-old male presented with tender nodules hand. So that is the clinical picture, and this is a photomicrographs from the lesion. Your time starts now.
Govt.
Yes, so it's a very classical picture and a straightforward diagnosis. Good. So it is Govt, 10 marks. Question number 5. We have not provided any history because it is a very direct case. So be specific in your diagnosis. Time starts now.
Castleman disease. Highly
specific.
Highly muscular variant.
Okay, good. 10 marks. So question number 6 is to team A. Yes. So female, 50 years, renal mass. Time starts now.
Madam, clear cell papillary carcinoma.
Yeah. So 10 marks. Papillary clear cell renal carcinoma, you could very well identify the papillary architecture and the arrangement with the apical snouts of the cytoplasm. So question number 7 to team B is a 54-year female with mass in uterus. Time starts now. Yes, you can try.
Endometrial stromal sarcoma.
Yes, can you be more specific with that? I can give you full marks if only you make a more specific. What is this that you're seeing?
High grade endometrial stromal sarcoma?
No. So I'll give you 5 marks. What you're seeing is the central hyalinization, that smooth muscle differentiation with the radiating, the starburst pattern. So if you had told that, I would have given 10, but 5 for you. Good. Next is to team C. Team C, your question, female, 35 years, complaining of swelling right maxilla since 6 months. This is the radiology. Your time starts now. And this is the photomicrographs. Yes, try to make an attempt.
High grade chondrosarcoma.
Which high grade? Can you be specific? Some classical areas are shown. Time over. It is the mesenchymal chondrosarcoma with the, yeah, they can be given 5 marks. The classical location, although it can occur anywhere else also, classical location was given, plus the classical round cell and the hyaline cartilaginous area. So question number 9 to team D. It is female, 63 years, lump left breast. Your time starts now. So try to attempt the question by seeing the histomorphology. Maybe if you get partial correct also, we can give you credit. Yes, the arrow is there. Some clues are there in these photomicrographs. Your time ends. So this is actually, you can see like the previous tall cell variant, here also the cells are tall and like papillary thyroid carcinoma, like nucleus somehow. Okay, and there is reverse polarity. The nuclei are situated towards apex. So it is this entity which has come up in the latest WHO 5th edition of the breast, tall cell carcinoma with reverse polarity. Okay. The final question to team E, female 39 years, subcutaneous swelling, right leg. Your time starts now. This is another rare entity. Just go through and at least pick out the salient features so that we can give some credit.
Madam, PHAT.
Excellent. Excellent. I can give you only 10 marks. I would have loved to give more. So it is pleomorphic, hyalonizing, angiotic tumor of soft parts. So all the features, pleomorphism, hyalonization, angiotic vessels with the perivascular, that fibrin-like material deposition, everything was there. Excellent. So 10 marks. So at the end of round 9, the scores are Team A 70 marks, Team B 55 marks, Team C 55 marks, Team D 50 marks, Team E 80 marks. So Team E is leading right now. All the best.
Next round is the immunohistochemistry round. This round has 5 questions. Each questions carry 10 marks. The questions will not be passed. First question to team A. Bone marrow biopsy of a 66-year-old male with splenomegaly, HND, ISC, CD20, annexin A1. Your time starts now.
Leukemia.
Pardon?
Hairy cell leukemia.
Correct answer. You get 10 points. Question number 2 to team B. 55-year-old female, mass in the left nasal cavity, HND, IHC, S100, SMA. Your time starts now.
Biphenotypic sinonasal carcinoma.
Biphenotypic sinonasal?
Sarcoma.
Very good. You get 10 points. Number 3 to team C. 51-year-old male, painless, non-tender, reddish-blue nodule on the ear. Clinical picture, HND, ISC, CK20. Time starts now. No, wrong answer. The correct answer is Merkel cell carcinoma. The dot-like positivity for CK20 is a characteristic feature of Merkel cell carcinoma. Fourth question to team D. 64-year-old female, growth in the cervix, HND, IHC, ER, P53, GATA3, TTF1. Your time starts now.
Secretory carcinoma.
No. Wrong answer. Correct answer is mesonephric adenocarcinoma of the cervix. This immunoprofile is a characteristic feature of mesonephric adenocarcinoma, and this secretion is also a clue to the diagnosis of mesonephric adenocarcinoma. Last question in this round to team E. Female, 24 years, pancreatic mass, H&E, IHC, beta-catenin, other IHC profile. Time starts now.
SPN, solid pseudopapillary neoplasm of pancreas.
Correct. Right answer, you get 10 points. So at the end of 10th round, the score is team A, 80 points, team B, 65 points, team C, 55 points, team D, 50 points, team E, 90.
We'll move on to the next round. That is round number 11 on immunofluorescent microscopy. There will be 5 questions in total, each carrying 10 points. 5 points will be for interpretation of IF microscopy and 5 points for the diagnosis. Case number 1, that is to team A. 47-year-old woman presents with annular erythematous plaques on the face. Pictures are given. Please give your diagnosis.
Dermatitis herpetiformis.
Team A.
Dermatitis herpetiformis.
No, that is a wrong answer. This is the case of discoid lupus erythematosus. The clinical and histologic picture is classical. And in immunofluorescence, you are seeing nuclear, IgG nuclear positivity. So the diagnosis is DLE. Case number 2. 55-year-old truck driver presented with fever, hematuria, and generalized edema. That is to team B. Team B, please answer. Time starts now.
Sclerosis and nodule amyloid IgM fever hematuria crescent glomerulonephritis.
No, this is a case of, that is a wrong answer. This is a case of focal segmental glomerular sclerosis. Here you can see the trichrome stain is seen where you can see the bluish sclerotic areas. In immunofluorescence, you are seeing only a portion of the glomeruli where there is IgM and C3 deposit in the mesangium as well as the sclerotic areas. Case number 3. Give your diagnosis by interpreting the figures given below. That is to team C. Time starts now. Team C.
Leukocytoclastic vasculitis.
Want the exact answer? Name the disease. You got the clinical picture also here. Okay. See, we needed a specific answer. I can give 5 points for leukocytoclastic vasculitis. So it is Henoch-Schönlein purpura, where you saw IgA positive deposits in the superficial dermal vessels. So there was purpuric lesions, there was leukocytoclastic vasculitis, and there was IgA positive deposition in the superficial dermal vessel. Case number 4. That is to team D. Given below is a histomorphology and immunofluorescent microscopic pictures of male presenting with hematuria. Give your diagnosis. Time starts.
post-streptococcus glomerulonephritis.
Can you say once more? Yeah, that is correct answer. So they get 10 points. You can see the hypercellular glomeruli. The star is the appearance with IgG and C3 deposition in the capillary loops and mesangium. Case number 5, that is to team E. 65-year-old male who presents with 10 blisters on palms and soles.
Bullous pemphigoid.
No, the answer is wrong. So they get 0 points. So this is a subepidermal bullying. And you can see in the direct immunofluorescence, IgG intense and C3 faint deposition in the dermoepidermal junction. The salt split skin technique is showing a deposition on the dermal side. Okay, so that is why the diagnosis is epidermolysis bullosa acquisita. Okay, so with this we come to an end of round 11. And here we have team E, that is GMC Trivandrum, leading with 90 points, followed by RCC, that is team A with 80 points. Then we have got team B, Rajagiri, with 65 points. And finally, we have got team C and D, Pushpagiri and GMC Thrissur, sharing 60 points each. Over to next, Dr. James. Yeah.
Okay, this is round 12. Molecular pathology. This round has only 5 questions. Each question carries 10 marks and the questions will not be passed. It goes in the order A, B, C, D, and E. So the first question is to team A. What investigation does this depict?
Next generation sequencing.
Okay, the answer is wrong. This is oncotype PX, in which 26 genes are assessed in cases of early breast cancer to know the risk of recurrence. So next question goes to team B. What is your interpretation of this case?
MSI unstable.
What will you tell the patient if you're the pathologist?
Hereditary Lynch syndrome, hereditary non-polyposis colon adenocarcinoma.
Yeah, so this patient, the answer is correct. You get 10 points. This patient is a case of adenocarcinoma who is MLH1 proficient and PMS2 proficient. MSH2 and MSH6 are deficient, but the internal control is positive. This shows that the patient has high likelihood of Lynch syndrome and he requires further genetic referral. Next question goes to team C. What is your diagnosis? There is one more slide. Time starts.
There is oligodendroglioma.
The answer is
1p19q co-deletion.
Okay, the answer is correct. You get 10 points. Oligodendroglioma, IDH mutant, and 1p19q deleted. Next goes to team D. What is your interpretation? 58-year-old male, high-grade mature B-cell lymphoma. These are break-apart FRISH probes.
follicular lymphoma?
Okay, the answer is wrong. You get 0 marks. So this is a high-grade lymphoma. MYC is showing one normal allele and the other is split. I mean, it's far away. BCL2 is also showing one is far away from the other, but BCL6 is normal. So this is a high-grade mature B-cell lymphoma with translocations involving MYC and BCL2. This is a double-hit lymphoma. Now this is case 5, goes to team E. What is your, there is one more slide. What is your diagnosis?
Madam, MITF associated Sri TFE3 loss.
Okay, your answer is, what did you say?
MYC translocation associated at RCC, TFE3 loss.
MIT
MIT.
translocation. So this is MIT translocation family. This is actually XP11 translocation renal cell carcinoma. The answer is correct. So you get 10 points. So at the end of round 12, Team A gets 80 points, Team B gets 75 points, Team C gets 70 points, Team D gets 60 points, and Team E gets 100 points. Thank you.
We are coming to the second last round, that is the last round on autopsy pathology. Again, the rules are the same. This round has 5 questions. Each question carry 10 marks and question will not be passed. This is to, first question is to team A. Your time starts now.
Madam,
Identify cheyana.
Yes, identify. Give your diagnosis.
90% burns.
Speak loudly.
Burns, madam. Burning.
Wrong. You get no points. The answer is toxic epidermal necrolysis, which is a life-threatening blistering disorder. This is to team B. Time starts now. Team B.
Pyogenic meningitis. Pyogenic meningitis?
Correct. The answer is correct. You get 10 points. Question to team C. Your time starts now. Team C.
Peritonitis.
Correct. You get 10 points. Question to team D. Team D.
Fatty liver.
Correct. 10 points again. Next to teams E. History of septicemia.
Tuberculosis. Disseminated TB.
Wrong.
Disseminated.
The answer is lung abscess. So we have come to the end of the autopsy round. And at the end of this round 13, team E is leading with 100 points. Team A gets 80 points. Team B 85. Team C again 80 points. And Team D 70 points. And we have come to the last round, that is the rapid fire round.
$60 seconds. Where presentation?
Each question 5 marks.
Each question 5. Screen share stop. Maybe. I haven't shared yet.
Next.
That is Zoom meeting. Is my screen visible?
Yes, sir.
And am I audible?
Yes.
Okay. So we move on to the last round. This is the rapid fire round, and each team gets 60 seconds in which they can answer a maximum of 15 questions. Each question carries 5 marks. Hence, the maximum marks you can get in this round is 75. If you do not know the answer to a question and you would like to attempt the next question, you can pass the question, but you do not have the option of coming back to a question you have passed. So, Team A, are you ready?
Sir. Sir, any negative marks?
No negative marks, only 5 marks for the correct question, no negative marks. Okay. Shall we start? Is there any doubt? Do you want me to repeat the instructions?
Sir, 1 second. Trishur Kananilla. Team B? No. Okay, it's okay.
Okay. So,
going to the next team.
By passing, we mean we move on to the next question. It is not going to the next team. Okay. Each team has a specific set of questions. Okay, shall we start?
Yes.
Team A.
Yes, sir.
You have 60 seconds. Your time starts before that. There is no history for any of these slides. These are all images. You look at the image and give me a diagnosis. There is no, you don't have to wait for any history or any instructions. So your time starts now. Diagnosis.
Acute lymphoblastic leukemia.
Correct. Diagnosis.
Hashimoto's thyroiditis.
Correct. Diagnosis.
Fungus.
Candida.
Correct. Diagnosis.
Close to that. Meningioma.
Meningioma.
Correct. Diagnosis.
Hamartoma.
Wrong. Next.
Next. Adenocystic carcinoma.
Correct. Next.
Your
time is up. Your time is up. No, that answer is wrong. Your time is up.
Excuse me, sir.
Yes.
So the images are not clear.
Okay.
Is it something to do with the net connection or it's not clear? I don't know if it's the same case for all the teams.
Some of the images are zoomed in. Probably the quality is
No, it's blurry actually.
So, yeah, these are the images we have. Okay, to make it fair, these are the same quality images for all the teams. So I'm moving on to team B.
Sharing. Screen.
Yeah, I'll start the screen share. Please wait.
ടൈം കഴിഞ്ഞാൽ പിന്നെ എല്ലാ ക്വസ്റ്റ്യൻ കിട്ടൂലല്ലോ അങ്ങനെയല്ലേ
ആക്ച്വലി ഇട്ട് കഴിഞ്ഞാൽ ഇതിലോട്ട് തിരിച്ചു വരാൻ പ്രയാസമാണ്. ടീം ബി അല്ലേ? Okay, team B, can you see the screen?
Yes, yes, sir.
You have 60 seconds. I hope you're clear with the instructions.
Okay, sir.
Okay, your time starts now.
Plasma cell myeloma?
Correct.
Squamous cell carcinoma?
Correct.
Fungus?
Can you be specific?
Mucormycosis.
Correct.
Schwannoma?
Correct.
Next.
Okay.
Adrenal cortical carcinoma?
Wrong.
Sorry. Lobular carcinoma?
Correct.
Next. Amoebiasis?
Correct. Your time is up. Team C, are you ready?
Yes, sir.
Is the screen visible?
Yes.
Okay. Your time starts now.
Harris looking.
Correct.
Raynaud's phenomenon.
Correct.
Mixopapillary ependymoma.
Wrong.
Spirochete?
Sorry?
Spirochete?
Wrong.
Pelgague.
Correct.
Next.
Hypertension.
Sclerosis. Onion skin.
Wrong.
Next.
Gangrene.
Cause?
Baldwin.
No,
Baldwin's.
time is up. Time is up. This is not Baldwin's, it's an intersusception. Team D, are you ready?
Yes, sir.
Is the screen visible?
Yes, sir.
Okay. Your time starts now.
Reed-Steinberg cell, Hodgkin lymphoma.
Correct?
RSL.
That was correct. The second one?
Next,
Next. Okay.
papillary carcinoma. Next,
Okay. The second one is correct. This is the third one.
pterygium.
Pterygium. Correct? Correct.
Next,
Next. Yes, this one.
next.
Sorry.
Megaloblast.
Wrong.
Next,
Do you want the next one?
leptospira.
Wrong. Wrong. Next.
Spirochetes. Next,
Wrong. The next one.
next.
Time up. Team E, are you ready?
Sir.
Is the screen visible?
Yes, sir.
Okay. The time starts now.
AML.
Correct?
TB.
Wrong.
BCC.
Correct?
Parafilaria.
Sorry?
Parafilaria.
Wrong.
Pass.
Full membranous qualities.
Correct?
Maybe C. Sorry, malaria.
Correct? Wrong. What was your answer there?
Babesia.
Okay, next. You.
Pass.
Pass.
Circulating crystals.
Correct?
Seminoma.
Wrong. The time is up. Since you had given two answers for one question, you will not be given credit for that question, the Babesia question. So that brings us to the end of the quiz. We will be, I'll just read out the marks of this round. Team A, RCC gets 25. Team B, Rajagiri gets 30. Team C, Pushpagiri gets 15. Team D, GMC Thrissur gets 15. And Team E, GMC Trivandrum gets 20. The final marks will be calculated and we'll get back to you shortly.
Good evening, everybody. Now our quiz is over. I would like to say a few comments and the result of the quiz. We had a little bit of difficulty in the beginning and in between, maybe because of the tension the quiz masters and the participants had. And now we have come to the end of the quiz. Let me tell the points. I think all of the teams did fairly well. A team, that is RCC team, gets 105 points. B team, Rajagiri team gets 105 points, equal. C team, Pushpagiri team gets 95 points. Team D, that is the GMC Thrissur, gets 85 points. And the last team, that is Team E, GMC Trivandrum, they got 120 points. So the leading team and the winner is GMC Trivandrum, followed by RCC and Rajagiri. 120 for GMC Trivandrum, RCC and Rajagiri, 105 points. Runners up. Over to you, Dr. Rajan.
Congratulations to the winner and all the participants. So it's a very close, tight contest. So Trivandrum won and closely followed by the rest of the teams. And luckily there was no technical issues in between, even though, but sometimes you get even more serious issues in between. So again, thanks to all the participants and especially special thanks to the centers where the quiz masters are there. That is GMC Trivandrum as well as the Regional Cancer Center Trivandrum. So thanks to all, and it was I think it took around 3 hours, almost 3 hours. Now it's 3:03. So it's a 3-hour program starting from it's 2 hours, right? So thanks to all. Congratulations to the winner once again and all the runner-up and rest of the team.
I think all are winners. Especially, I congratulate the Rajagiri team. That is not a medical college, dependent students in a hospital. They did well in the preliminary round as well as now.
Madam, Rajagiri, they have completed the DCP and Shubha is from Calicut. She has done DCP from Calicut.
Okay.
And so
thank you, ma'am, and thank you, sir. Thank you, ma'am.
All are winners. All teams are winners because they all did well. That's what I felt.
Yeah.
All teams are winners. They did well. Okay. Thanks a lot to Dr. Rajan, Annie, Mindray, and all for giving us the opportunity to conduct this for the IAPM. See you all tomorrow.
Forward to
the
IAPM chapter meeting tomorrow. So see you at 9 a.m. sharp. Okay. Thank you.
Okay.
Thank you all. Congratulations
thank you,
to
all
madam. The 5 teams. All did very well.
Yeah. And thanks for the Mindray, Nikhil and Shema and Naveen also. So we hope to meet tomorrow morning at 8:45. The Zoom will start and 9 we will start the program. Thank you.
Okay.
Thank you, doctor.
Yeah. GMC Trivandrum, what is your name, please?
Especially for your hospitality arrangement. Hello. ഞാൻ വീട്ടിൽ വന്നിട്ട് വിളിക്കാം ഒരു ഫംഗ്ഷൻ ഇല്ല വീട്ടിൽ വന്നിട്ട് വിളിക്കാം ഓക്കെ ഓക്കെ
Yes, madam. Yes.
പിന്നെ രണ്ടാമത് നമ്മൾ പറയാന്
Thank you, Nikhil.
Thank you.
കുറവുണ്ടായിരുന്നു തീർച്ച പറയും ഇത് വന്നപ്പോ തൽക്കാലത്ത് ഇത് മനസ്സിലാക്കിയായിരിക്കും അവരും ചാടി